My name is Jacqueline Schenk. That's how you pronounce it, Professor Keenan. I'm representing the Netherlands from the School of Pedagogical and Educational Sciences, no longer the Institute of Psychology, because we're actually setting up a new bachelor and master course. Regretfully not in ABA, but we are teaching proper experimental and applied behavior analysis. We only have 10 minutes. Normally I just keep on talking, so thank God for Stephen, who's going to warn me. I just have 3 separate sections, or a little bit about the past of behavior analysis and applied behavior analysis, in particular in the Netherlands, the here and now, and the future. In the past, in previous stamp meetings, I always sort of was slightly ashamed of, the message that I had to tell everybody about the status of affairs in Holland about ABA education and training at universities, but also at different levels of education, and also opportunities, reduced, very limited opportunities for ABA professional training. To enable practitioners in the field and parents working with children with autism to become skilled. So regarding the university, that's where I'm working. If you look at Holland, it's slightly bigger than Iceland, but still limited number of universities, 8. All of them have a department of Faculty of Social Sciences. All of them offer courses, bachelor and masters in psychology, pedagogy, orthopedagogy, which is developmental disorders, which I'm program director of, and educational sciences, and none of them are offering any ABA modules, let alone, sort of whole masters. Regarding the professional practice opportunities, we had a review done a year ago, published in Dutch, unfortunately, about what has actually been used by professionals, by parents as therapists. What it comes down to is that everybody who is working in ABA or applying principles and the methodology of ABA with children with autism are self-educated or they're very motivated to learn from each other, so parents train each other as well. But there is lack of professional ABA training, despite the fact that in a report dating back to 2009, the government of health concluded that ABA based interventions were the best type of interventions available. We do have different degrees of evidence that is supporting interventions. Even magician therapy, I thought that was the most ridiculous example of an intervention that was even mentioned in that report, was there, even though it lacked any theoretical or evidence-based ground. The ABA-based interventions were at level 2, which means no randomized controlled trial evidence, but it's theory-driven and there is some evidence from NS1 that illustrates the dominance of the way science in the Netherlands wants to find evidence for effectiveness of interventions, which is quantitative. Large numbers should all be doing the same, which of course, is impossible with ABA. Doesn't mean to say that I'm going to fight that battle, because as you were saying this morning, pick your battles and stick to your expertise. But it does hinder the acceptance and the further development of ABA. So to make things easier, there's a lot of changes again. It seems that in Holland we are just reforming healthcare and the educational system year after year, because this is yet another sort of 2 major changes, both in healthcare for children as well as in education, that are going to be up and running. I should have put that in how do you call them? Inverted commas, should be all up and running from 2015, which means regarding youth healthcare, more responsibilities given to councils, to schools and to parents, just to reduce costs. So that means that people who do not have expertise yet are going to be generalist. That is the term for the person who is going to be in contact with schools and with families and with healthcare organizations to look after children, including children with autism. So that's quite worrying, and at the same time there are also major reforms in the educational system, which means that all children with autism can go to regular schooling. And I've included the Dutch word passend onderwijs just to illustrate how difficult sometimes it is to find equivalent translations for English terms. So it's just a variety of inclusive education. Together with growing classes, we now have classes consisting of 30 to 35 students with recently qualified teachers who do not have, they haven't had any training in ABA, they haven't had any training in observation of behavior, so it's just, disaster waiting to happen. And the continuity of education and care for children, schools are responsible, and that is quite worrying. So what we try to do now, and also from where I'm standing, is to try and use Simple Steps as multimedia project, which it is fantastic. It really is. To include that both in training and in education. And what I can do is to include that in university teaching at bachelor level and at master level. And I think it does feed in nicely with the growing needs of parents, of schools, of teachers for managing behavioral problems of children in their families or at school, and it facilitates the coordination of children learning and teaching of children in the different contexts. We call that the FIT. So the future in Holland, Simple Steps is going to be available soon to parents and other educators, and we'll be using that as a training tool in our modules, both as for psychology and educational sciences students, so that's bachelor level and master level, and I do that in close collaboration with one of the few services in the Netherlands who is using ABA. So that's really good because then we can sort of learn from each other. And also to feed into the need for teachers who are dealing or confronted with children with autism in the classroom, in a very big classroom of 30 to 35 students. We'll also be using that to train students who are part of the academic teacher training track. That is like a 5-year training that is going alongside, their work as a teacher in primary education. So we are sort of helping them to develop skills regarding behavioral observation and functional analysis while they are at work. So that's, in a way, the timing of the launch for Simple Steps is quite good. Thank you, Stephen. And regarding research, I think, if you tell your students, only use evidence-based, assessments, intervention stuff, we also need to do that for Simple Steps. So we need to assess what the added value is of using Simple Steps as a tool for parents, for teachers, and you need to do that by proper scientific research. You should practice what you preach. Since last week, we know that we are part, the Erasmus University, of an academic and professional consortium, which is in collaboration with the Leo Kanner House in the Netherlands, which is a big organization providing services for children, but also adolescents and adults with autism. And we will actually be including research projects there, including Simple Steps. And we also plan to use some of our own students as participants, because now they're not being trained using Simple Steps, and later on in their curriculum they will be trained, so you can do baseline now and see how their skills have increased. And I think that's what you need to do, and I can only say I'm very, very grateful for having been included as a partner in the STAMP project. That is how our financial guy pronounced it. He still has a little bit of work to do. So thank you very much for having me here today, particularly the University of Ulster and Queen's University of Belfast. So I'm sure you'll be hearing a lot about this from the Netherlands soon. Thank you.